us. My name is Liz. We are going to go ahead and get started because we do have a lot of information to go over this morning. Thank you again for joining us. We're going to jump right on over to Dr. Eric Sergienko for a quick update.
Hi, Eric Sergienko, the County Health Officer, and thanks for joining us on this Christmas week. Looking forward to a safe and happy holidays for everyone. Um, Really, right now in Mariposa, in our region, in terms of COVID, we're actually looking at the lowest rate of cases since we saw the start of the Delta wave back in July and August, and that has been also reflected in decreasing hospitalizations. So, in terms of COVID, we're doing really quite well. We have not yet identified cases of Omicron, and I'll talk about Omicron in a bit, uh, in Mariposa. Though certainly we have it in California and throughout the United States. So I think it's really only a matter of time. But in terms of where we're at with the COVID pandemic in Mariposa, looking really pretty good. Um, Looking at the healthcare systems around us, and again, more concerned about uh, cases when it leads to hospitalizations, when hospitalizations lead to an increased demand for healthcare services, and when that increased demand leads us to surge. What's really happening right now in the healthcare system in the region is people are seeking healthcare for all those things that they have deferred for the last 18, 20 months over the pandemic. So things like elective surgeries, but also other medical emergencies coming up. And then the other thing that we've seen is a lot more respiratory disease than we've seen in the last 18 months because people are out and about, they aren't wearing masks, they're socializing more, and so we're seeing those viruses, whether it's respiratory syncytial virus or influenza, now being transmitted more than it was, say, a year ago. So those things are causing the healthcare system to be strained, but not into surge. And so the challenge is you've got this healthcare system that is doing okay right now, but not great. We are receiving help from the state at a number of our hospitals in the region for staffing. And really, when we talk about available beds in healthcare system, it's not a physical bed. It's the nurses, it's the technicians, it's the doctors that ensure that that person who is in that bed is getting an adequate level of care. And that's really where the challenge is because of the length of the pandemic, because of ongoing challenges with patient care. We've actually seen about 18% of nurses throughout the United States get out of healthcare. Similarly, we've seen doctors shift their careers around. I've had two friends of mine in emergency medicine recently in the last 2 weeks get out of emergency medicine and go into other parts of medicine. So that's kind of the challenge that we're facing as we're coming into what's likely to be our next wave, and that next wave is likely to be Omicron. And even if we don't have a significant Omicron wave, we may end up seeing what we're seeing in the northeast of the United States right now, which is Omicron combined with a Delta wave. But what we know about Omicron is it was a variant that was identified first in South Africa on the 22nd of November. And in that week, they already started seeing a significant increase in cases. And then over the last 4 weeks, they've seen an increase in hospitalizations to where they aren't quite at the level that they were during their Delta surge, which happened over their winter, our summer, so August into September, but almost to that level. And so straining the healthcare system. So again, something we want to avoid here. The thing with South Africa is it's a largely unvaccinated population. About 26% of the population in South Africa are fully vaccinated, and the vaccine that's predominantly used there is the Pfizer vaccine. So what we do know from data in South Africa is that the Pfizer vaccine does reduce hospitalization, does reduce death. And if we look at the people who are in the hospitals in South Africa, about 65% of them are unvaccinated, about 30% of them have one dose in, and 5% of them are are fully vaccinated. So from that data, from other data, in South Africa, we can say that the Pfizer vaccine is still protective, at least in terms of reducing severity so that you don't end up in the hospital or end up dying. Then we look to Western Europe, and specifically looking at data out of Denmark and data out of England. Right now in England, or correction, in the United Kingdom, not just England, is that they're doubling cases about every 2 days. They aren't yet seeing that same steep increase in their hospitalizations. And they are seeing an increase in hospitalizations, but not yet sort of that skyrocketing that we saw in South Africa. And so the question is it just too early in their Omicron surge, or is it because it's a more highly vaccinated population, and so they're going to see a slower roll, if you will, on the number of hospitalizations? I am hopeful that it's the latter, but I think it's probably too early to tell one way or the other. And the same sort of situation in Denmark, where we're seeing an increase in cases and an increase in sort of an exponential growth in cases, but sort of a linear growth in hospitalizations. And then just recently, in the last week, we've seen that same sort of exponential growth in cases in New York and also in Miami, and so specifically New York City, but all throughout sort of New York and then moving into New England. Also in Miami-Dade, in Florida, and then some parts of Texas. We have not seen that surge here in California. The first case in California was in a traveler that returned on the 22nd of November and then was identified on the 1st of December. Since then, we've identified Omicron in numerous counties. There have been clusters in Yolo and Alameda counties, and significant clusters occurring in San Diego. But again, in the Central Valley, in the San Joaquin Valley and adjacent counties, we've identified it in wastewater in Sacramento and in Merced, which means it's probably here, but we just haven't found it yet. And I'll say that's, we only sequence about 10% of all the total specimens tested. And so, again, probably only a matter of time until we find it here in Mariposa. That said, again, as I mentioned, the Pfizer vaccine was found to be effective in South Africa, and then some studies coming out of Moderna and out of Pfizer that are in vitro, that is using serum from people who've been exposed and reduction of antibodies, is Pfizer is effective, again, against the Omicron variant in the lab setting. 3 doses are better than 2 doses. So if you've not had the opportunity to get boosted, get boosted. Moderna today released similar data saying that if you got boosted, it provided a very good protection against the Omicron variant. So those interventions that we've been using against Delta and previous strains work against the Omicron variant. Perhaps to a less extent, but markedly more than nothing at all. So again, encourage people to get vaccinated. Get your first series if you have not started it yet. Get your boosters if you have completed your first series. Other things I would mention is all those other non-pharmaceutical interventions that we talk about and have been talking about for the last 2 years is wear a mask when you're out in public in an indoor space, good hand hygiene, stay home when you're sick, and get tested. Kristina will probably go into some details on testing. We moved our testing site from the senior center back to the yard slot, and some more details on that. And think about travel. Think about those bubbles. Coming back to that discussion that we've always had is, think about the people you are getting together with. And if you happen to become sick or they happen to become sick, know who you can reach out to so you can notify your contacts and let them know that they should quarantine, that they should get tested. And so those are kind of all those basics. And then in terms of holiday safety in particular, test before you travel. And we recommend that you test after you come back from travel, about 3 to 5 days after returning to Mariposa. So all those prudent measures that we've been doing throughout the pandemic, bringing those back. And we've been reaching out to our businesses because, again, Omicron seems to be spreading much more rapidly than Delta, so all those non-pharmaceutical interventions are important in the business place. So encouraging our business owners to make sure their employees are masked. Tara Schiff from our economic development within the county administrative offices has been working with them to make sure that they have masks, that they can have an N95 respirator if they need it, because that's something that Cal OSHA has as a requirement for the workplace. Kristina will talk about some new breaking news about our availability of home testing. But we unfortunately don't have enough N95 respirators to distribute to the general public. So I'm going to, on that note, switch it over to Dr. Allen and update on testing, both at the testing site and with home tests, and about vaccinations.
Thank you. Yes, so as Dr. Sergienko mentioned, our testing site did relocate. So it's no longer at the senior center. It is in the Yards parking lot behind Rite Aid. So hopefully you've seen the flyers and advertisement for that did move as of December 14th. So if you're looking for the LHI testing site, it is now in that parking lot. They hold the same hours, and they're open Tuesday through Saturday. The breaking news, as he said, we have the self-test at home testing now available. I will caveat that with its limited quantity right now. We do expect to get much more, but for now, we do have some, and these are available for free over the counter, and we don't need any information from you. So we do have a few here on hand, not a lot, but we will be getting more. So this is something you may have seen on the news, even today, yesterday. Some other counties in the state have received theirs and are distributing them as well. And we received ours just a couple hours ago. So excited to share that with everybody. There are 2 tests in every kit. So when you get them, just know there's 2 tests in there. We recommend them. Let's try to prioritize those people who may be symptomatic or have recently traveled, since our quantity will be limited. But we'll do the best we can to get those out to the community who needs them. And so more to follow with that. We have to work out the logistics on how the best way to distribute, but we do have them. So keep an eye on our Facebook and other means of communication to see how we're going to go about that. So that's testing. I also wanted to mention our clinics. So we do continue to hold our vaccine clinics. And actually starting this week, we are going to offer them Tuesdays and Thursdays. So we'll have 2 days a week. So the 21st, tomorrow, we'll be here. All of these clinics are here at the Community Health Center, which is at 5300 Highway 49 North. And so tomorrow, Tuesday, from 8:30 to 12, and then Thursday from 8:30 to 12 as well. And then next week, the 28th, 8:30 to 12, which is also a Tuesday, and Thursday, the 30th, 9 to 12, and 2:30 to 4:30. And we'll continue this Tuesday, Thursday model into the future. It seems to be working for us right now, so we anticipate we'll keep that going. We are doing these clinics indoors now. You may have seen us outdoors often, but because of the weather, we have moved these operations indoors. I do encourage everyone to go on My Turn and make an appointment. It does make things go faster when you do show up for your appointment. There's not as much that paperwork that you need to do when you come in. You can just check in if you've already scheduled your appointment on My Turn. So we do encourage that, but also understand that not everyone has access to computer or internet, and sometimes the calling in can also be cumbersome. So if you can't make an appointment on My Turn, we will accept walk-ins, but they will be limited on what we can, the capacity we can have that day. So encourage those appointments going to myturn.ca.gov and finding the clinic you'd like to come to and creating your appointment that way. We will have January clinics that we already have scheduled are on the 4th and the 6th, the first Tuesday and Thursday of the month, again here at the Community Health Center. And then on the 12th, we'll actually be at the Greeley Hill Community Club, and we'll be there from 1:30 to 3:30. So those are our scheduled clinics right now. We do anticipate scheduling probably 2 clinics in January that will be at Tenaya Lodge, and of course our regular Tuesday, Thursdays here. So watch my turn for those. Also, this whole schedule can be found on our county website. If you go to the COVID website, the whole schedule is listed there and updated daily as scheduled when we schedule our clinics. And I think that is all I had. Eric mentioned the N95s that we do have for business owners. Very limited supply, so we keep those for our local businesses. We'll just reiterate that. And other than that, I'll turn it back to Liz.
All right. Thank you both so much. You definitely touched on some of the topics that we have coming in with questions, but we'll go through them all just to make sure everyone is clear on the information. So we're going to go ahead and start with our very first question coming from Suzette. Are you still testing wastewater systems? Which ones and what are the results?
So we paused for the season, recognizing that the reason we do testing our wastewater is to pick up on travelers that are carrying it with them. And actually we found it very useful for anticipating when we would start seeing cases in Yosemite Valley, less so in Mariposa. And so we paused that after Thanksgiving. We'll restart that up with the sort of the springtime, April into May, and look at what happens as our visitor travel picks up then. And I recognize that we've got Christmas travel, but the time lag between sending off tests and receiving them won't give us that much of a heads up, unlike travel that's more continuous over the 5 or 6 months of summer.
All right, and we do have the results posted on our website as well. The team will drop that in as well, so if you want to keep an eye on that throughout the summer season, you can check it out. Our next question is coming from Mike. Do we need to upgrade our masks for Omicron?
Yeah, that's actually one of the things that I think is worthwhile, and we did talk about N95 respirators. But I think really what I've started doing and what I think is a prudent measure is to wear a medical mask, medical grade mask. Got one here handy. These are made a little bit tighter weave than a cloth mask, so more efficient at containing your droplets, which is what you're doing. You're doing source control, and it's also somewhat more effective in protecting yourself from inhaling those droplets or pulling in aerosols. And then, as mentioned, N95 definitely recommended for in a healthcare setting, and then as mentioned, under the emergency temporary standard that Cal OSHA has, is that if an employee requests an N95 in the workplace, the employer is obligated to provide that.
Thank you. Our next question is coming from Sandy. Have any Mariposa cases been hospitalized after being fully vaccinated?
The answer to that is yes, and Kristina can correct me if the numbers are wrong, but I want to say it's 2 out of 4. Okay, but a small percentage as compared to the number of people who have been unvaccinated. And I remember that we had one dose. So. But again, demonstrates that we're going to have people that are fully vaccinated that get hospitalized. It's not 100%. We've said that since the get-go, and I even anticipate that we will have people. I'm hoping it's a long while, but we've had people in the state who have died who've been fully vaccinated. So it's not 100% protective. It is significantly protective, though, against Delta, and then what we know with the initial data with Omicron, it's about 70% effective at reducing hospitalization and death. So more to follow in terms of developing vaccine effectiveness data with Omicron, but again, not 100%, but way better than 0% that you have without having a vaccine.
All right. Our next question you kind of just answered, but if you can just expand a little bit more. The question is from Sarah. I've seen different numbers from different places about how well vaccines and boosters work against Omicron. What is the truth?
So this is one of those things that, getting back to March of 2020 is communicating uncertainty. There's a lot of data coming out. We didn't know about Omicron a month ago. That's how recent all of this data is we first identified Omicron on the 22nd of November. And so since that time, you've got people who are looking at epidemiologic data, that is, how does the vaccine work in the field? So stuff out of South Africa. There are also people looking in the lab, in vitro, looking at serum and how well that serum works against a viral challenge. And so I've seen numbers as low as 30% with 2 doses and 70% vaccine effectiveness with 3 doses of the Pfizer. That's why we encourage boosting. And then similar data around the 70% number that was released by the largest managed healthcare corporation in South Africa. So again, speaking to the Pfizer and having 3 doses, it seems to have a vaccine effectiveness of about 70%. Where we were talking about with Pfizer and Delta, Pfizer, the original variant, around 90%. So again, less effective, but still around that 70% range with 3 doses, maybe 30, 40% with 2 doses. Moderna, I have not had a chance to look at their report today. I know it was released, but I have to go back and look at that, and I've not seen any data from Johnson & Johnson as of yet.
All right, thank you for expanding on that. Our next question comes from Jackie. What can you do when businesses aren't following masking guidance? Can you find them or close them down?
So, short answer is theoretically we can. It's if a individual or a business is not complying with the health officer's order, which is what the state facial masking or masking guidance is, it's a misdemeanor. But typically those misdemeanors are enforced by the sheriff, and Sheriff Breeze had mentioned at the last board meeting that his focus is on education and information, and that's what we do too, is educate and inform, and hope to gain cooperation that way. So if it's a business that is regulated or gets an environmental health inspection from us, one of our registered environmental health specialists will work with that business. And then we'll work with other businesses. Again, Tariff Shift is providing supplies as needed. And if it really becomes a challenge, we have in the past engaged some state agencies, Cal OSHA is an example, to ensure workplace safety. They can fine up to $14,000 if there's a business that's not in compliance. And then in other times we've used or worked with Walter Wall, the DA, to look at unfair business practices. And again, really what we want to do is make sure people are safe. And so I won't say, we won't fine people, we won't do what I would think of as extraordinary measures. I'd rather just have people understand that masks are effective, masks work. The science is solid. There was an update of the CDC science brief that came out on the 6th of December. So again, us sharing that information, I really want people to understand that masks, especially as mentioned from a previous question, or upgrading your mask to a surgical mask, really does work to decrease transmission and makes for a safer community.
Thank you. Our next question is from Matthew. I am hearing mixed guidance regarding boosters after receiving the J&J vaccine initially. Recently, the White House response team indicated that they would advise people who had received the J&J vaccine to act as if they had never had a vaccine and start over. Is this the recommendation? What should residents of Mariposa County do if we should be seeking additional vaccine doses but have already received an initial J&J vaccine and a booster?
Got it. So if you received a J&J plus a second J&J, or if you received only the J&J, what I would do is do what's called heterologous dosing, or mix dosing, or mix and match. Because we know if you layer on a mRNA vaccine in addition to the adenovirus vaccine that this J&J is that you get a marked boost in your immune response. And so, if all you've had is the Johnson & Johnson, I would go ahead and recommend that you get either the Pfizer or Moderna, which are both mRNA vaccines. And the data seems to support Moderna over Pfizer in terms of a boost, but both will boost it over what the Johnson & Johnson provides.
All right. Our next question is coming from Pam. Does the booster have the same side effects like the first two?
So the short answer is yes. As I will say, with every shot you get, your mileage may vary. Your experiences may vary. I will say that I had, so those of you who don't remember, I actually had a case of COVID back in September, and I was going to hold off 90 days until I got my booster. And I turned out I was doing a booster clinic down at Sierra Foothill Charter. And thanks for having us down there, guys. And we ended up having 3 doses of Moderna left, and it was either waste it or use it. And so I gave myself my booster shot, and my side effect at that point, and I had, if you remember back to the beginning a year ago, I went ahead and did the Pfizer as a healthcare worker. So I mixed and matched. I did a Moderna, and the only side effect I had was I was just really, really tired, and just wanted to get extra sleep. Other people I've heard about achy, fever. I don't know what other experiences people have, but Kristina wants to answer that one.
Yeah, I did about 36 hours after my booster dose. I was achy. I had a fever for about an hour, and that was it. It was a rough hour, but that was all I had.
Yeah, so again, your experiences can range the full spectrum of side effects that we've seen with the COVID vaccines.
Yeah, and taking it all the way to the other end, I had no symptoms after any of my 3 doses. So wide range. Our next question is coming from Debbie. Why was the Mariposa testing site moved to an outdoor site during the winter?
So it is a drive up, so hopefully you can stay warm in your car. But it was really the only location we could find in the county to relocate the testing site. We tried many avenues, and luckily the state testing task force was available to get a van, the bus that you see out there. So it was really our only option. It was either that or not having a testing site, and we didn't want to do that.
No, I think it's important to know that the senior center is not owned by the county. We leased that space, and the owners of the space wanted to have their rooms back for use. And optimistically, they want to have those spaces available for rent and etc. So respecting that, respecting their wishes, looked for a space really hard indoors and really could not find one. And so we ended up with a testing site. I agree, I wouldn't want it outdoors, but I'd rather have a testing site than none at all.
Thank you. Our next question is coming from Tom. When should I test if I am gathering with other people?
So we recommend testing beforehand. So a couple days beforehand. We've had really good turnaround time with the testing site. I got my results back in about 36, 38 hours. So plan on maybe 2 days or 3 days before, and then 3 to 5 days afterwards. And the 3 to 5 days afterwards is the incubation period that we see most cases pop up in, is in that time range. And the same holds true for travel. If you're traveling and mixing with other people, when you return, 3 to 5 days after you return.
All right. Our next question is coming from Lonzo. I'm confused. Some people say vaccines don't keep you from getting COVID at all, just from getting super sick or dying. But other people say they keep you from getting sick, not all the time. Can you explain?
You bet. Yeah. So I think it speaks to that your body has multiple defense systems. It's not just a single thing. We talk a lot about antibodies and antibody response, but you have other cells that are involved in your immune response that fight the infection. And so if you're able to repel the infection at the earliest point, that is your nose, where the virus is inhaled and meets your body and looks for an ACE receptor, if you mount a sufficient immune response there to a low enough viral load, you'll never get infected. You'll never develop an infection, and you'll shed the virus. You won't shed the virus. You won't transmit it to anybody else. That's the optimal outcome. But if that defense mechanism is overcome, then other parts of your immune system mitigate the impact of the virus and will have you have more mild symptoms. So rather than having something that requires oxygen or requires lung support, you just have a really bad cold. And so it's multi-layered, multifactorial. We know that against the Delta variant, that we were looking at 6 to 10-fold reduction in the likelihood of being infected, 10 to 12 time reduction in being hospitalized or dying. So you're seeing all those layers of benefit, and it just depends upon where the vaccine is able to work against that virus and how much virus you're getting. So I had a full set of vaccines when I got infected, but I was at the tail end. I was like 9 months into my, from when I had my last shot. So I had waning vaccine effect against probably a high viral load. So my initial defenses got overcome, and I was sick, but I was never so sick that I don't tell anyone else. I'd never really stopped working. I just worked from home in my isolation. So yeah, Kristina's shaking her head. So that was the level of symptoms I had. I never had a fever. I just was tired and achy. And so that's sort of the reduction in symptoms that I had. So it is protective, and it does reduce the likelihood of a severe outcome.
Thank you for explaining that. Our next question is coming from Summer. Do you address the significant, serious, long-lasting side effects that can occur, specifically the neurological side effects and heart issues?
Sure. So I don't know about neurological side effects. I mean, we've talked about Guillain-Barré, which is an ascending paralysis. That actually hasn't been shown to be associated with any of the vaccines, though they look for signals of it. I think that speaks to the ability of us to do vaccine safety tracing. The one thing you may be speaking about with neurological is with the Johnson & Johnson vaccine, what's called central sinus venous thrombosis, where clots form in sort of the central sinus of the brain. And that's been noted in a number of people and has resulted in about 9 deaths and that's with the Johnson & Johnson out of the millions of doses of that. So it's very rare, but it was able to be noted a couple months ago. I want to say June was when it was first noted, and then they've been tracking safety data since then. And so that is a concern, and it occurs predominantly, and we noticed it back in when it was first noticed, predominantly in women of childbearing age. And so we may want to tailor the vaccine recommendations to avoid Johnson & Johnson for that population. The other thing that you mentioned is heart issues, and that's myocarditis or perimyocarditis, which is inflammation of the heart muscle or inflammation of the lining of the heart. And that's been noted with both the Pfizer and the Moderna vaccine, more so with the Moderna than the Pfizer, and typically in younger men. And again, very, very small numbers, which I think speaks to our surveillance system and vaccine safety monitoring. And what we do know is that the benefit from getting the vaccine, and even speaking in terms of experiencing myocarditis, you're more likely to get myocarditis from a infection with COVID than you would from either the Pfizer or the Moderna vaccine. And even so, if you wanted to reduce the risk, use the Pfizer vaccine over the Moderna if you're a young man.
All right, thank you. And I will add, Kristina might have more on this, but our public health nurses are really great at answering a lot of these questions at vaccine appointments. So definitely recommend speaking with them.
Or give us a call. We love those one-on-one conversations, and if there's something that they can't figure out, we'll get back to you.
Great. Our next question is coming from Donna. Why isn't the new testing site a drive-through? I get tested every week, and last week it was very cold. A drive-through would be more welcoming.
Yeah, that was originally what the plan was, but I understand now, I haven't seen it myself actually, so Eric may be able to speak better to it, but I understand now that it is a drive up and you get out of your vehicle. Is that true? Okay.
That is true.
We did request a drive-through. The testing task force just with the state, they just could not accommodate that right now. No telling what it could be next month or the next few months, if they're able to accommodate that. So we will try. But again, it's what we could get.
Yeah, no, I agree. A drive-through would be great. I actually didn't mind getting out of the car, and it was cold and wet and rainy, but they were very quick. And so timing is important, making an appointment and keeping that time. But yeah, I would rather have it a little warm. Maybe like those heater things.
Yeah.
Okay. Thank you, though. That idea.
Our next question is coming from Olga. What are the requirements for traveling from other countries to the USA?
Whew. I'm actually going to defer on that question because I know the CDC has websites and the guidance, I won't say changes every day, but it depends upon what country you're coming from. But at a baseline, what you want to do is be able to test 3 to 5 days after your return, and there may be some requirement to quarantine depending upon the country that you're coming from. And Liz may be able to put the link to the CDC travel site into the chat. That may be the best thing to link onto rather than me making something up.
Yes, we'll go ahead and add that link shortly.
Thanks.
All right, our next question is coming from Jean. Can you explain how masks stop COVID if the virus is small enough to go through the mask?
Sure, because we're not really looking at the virus. We're looking at the droplet that the virus is contained in. So you think about it, when you sneeze or you cough, you're generating large droplets. And that's really what you're stopping with the mask. You're not stopping the virus itself, because if it was just the virus, then yeah, it would get through that. But you're stopping the droplets. And that's why it's more source control than it is protecting you. But it also serves as a protection for you because, again, those droplets that are hitting the outside of your mask are getting stopped. And there's even some slowing down, if you will, of the viruses because you're creating a pathway that makes it harder for them to find your nose. So it does work to reduce but not eliminate that aerosol risk. And so aerosol are the smaller, like microparticles as compared to the droplets. And so again, masks, great against droplets, not so good against aerosols, but still reduce the risk.
All right. Next question is coming from Brandon. Just curious, since San Francisco, Contra, Costa, Alameda, and Marin counties are exempt from the mask mandate, does that mean that COVID stops at borders?
So yeah, this is one of those difficult to explain things, but those counties had, and other counties had, existing masking guidance, and the state got some feedback from those counties that given that the mask mandate from the state was only from December the 15th to January the 15th, that would disrupt what those counties were doing with masks in their jurisdictions, and that it would create just a logistics hurdle for them, and that their case rates were so low, and they do remain lower than pretty much all of the remaining counties in the state, that was an acceptable risk. And no, COVID doesn't stop at the borders, but I will say that our rates have been much higher in the region here in the San Joaquin Valley than it has been in the Bay Area. And so whatever public health measures they've been implementing have been more effective than what we've been doing here. So again, it gets back to them. They've been wearing masks, they've been testing, they've been vaccinating more. So if we followed those behaviors, we'd have a lower case rate as well.
And we do have the team adding a link to the health officer orders for those areas so you can see the work that they are doing if you all are interested in how we can help reduce the spread even more. Our next question is coming from Julie. What are the parameters for county offices to open to the public?
So those are set by the department heads themselves, and it has to do more as much with operations and logistics and their ability to ensure the safety of their staff. So what their workspace looks like, the risk factors associated with their own employees. So as an example, here at Health and Human Services or at Public Health, our lobbies are open, but we know that there are other departments where it's tighter spaces, not as good air circulation. They have staff that have more underlying medical conditions that put them at risk, where those have been closed. The other thing that we consider is what's the prevalence of disease in the community. With the retirement of the Blueprint for a Safer Economy, we had to switch gears to what's called the CDC data tracker. And the CDC data tracker looks at the county level of what the level of disease is, both in terms of percent positive tests and case rate per 100,000. And it has 4 levels, just like the Blueprint for a Safer Economy goes from high, which is red, to substantial, which is orange, to moderate, which is yellow, to low, which is blue. So different color scheme, but still 4 steps and about the same measures. And so in terms of the county guidance for office spaces, masks are required in them until we hit the moderate level. And we've not been there for since the beginning of the Delta wave back in August. So that would be one of the requirements. And then the department head of that particular space saying, let's go ahead and open that space up again.
Thank you. Our next question is coming from Jenna. Could you elaborate on who should get a booster if you're fully vaccinated?
Everyone. I think that's pretty much the bottom line. Is there's no reason at this point in time, if you are eligible for a booster, that you should not get a booster. Especially given what we're learning about the Omicron variant now, and like I mentioned earlier, the difference in effectiveness between 2 doses and 3 doses.
Our next question is coming from Mike. Regionally, do we have sufficient ICU availability to handle emergencies such as heart attacks and the like?
Always a concern. And I will say that there are challenges right now, even with our low percentage of COVID hospitalizations, of transferring patients from John C. Fremont or Critical Access Hospital to tertiary care facilities like CRMC in Fresno or doctors in Modesto. So like that's where I say we're at strain, but not surge. And so we have had challenges. I was working in the ER this weekend. We had a delay in transfer for a patient who was having a heart problem. And then previously we had a patient that had a very bad outcome because we couldn't find an available bed with a general surgeon. And so those are going to happen. They're manageable right now, but very challenging. My concern is if we started having more cases, regardless of whether it was Delta or Omicron variant, that would push us into surge and maybe even to crisis standards of care, where we're making very difficult decisions about patient care based upon scarcity of resources. So right now doing okay, but if we had more cases, it would get very tough very soon.
All right, I'm doing a quick check. I believe the next question was answered. All right, and I'm not seeing any more questions. I'm going to turn it back over to the doctors for a quick roundup, and we'll go ahead and start with Dr. Sergienko.
So I think, realistically, whether we're dealing with Omicron or Delta, all the things that we've been doing during this pandemic from March 2020 to the present still remain the same. The only thing we've layered on is vaccines. So get vaccinated. If you haven't done that yet, if you are fully vaccinated, get boosted. Stay home if you're sick. Wear your mask if you're out indoors in public. Get tested. Stay safe and have a happy holiday. And we'll see y'all in the new year.
Thank you. Dr. Allen, anything to add?
Sure. I just always like to add a reminder to everyone that our team is working really hard. We are humans too, and we're just exhausted as the rest of our community. So just a reminder that we are working hard on communication and education around COVID-19, and we do recognize the divide that COVID has created in our world, and we just want to remind everyone that the most effective way to bridge this divide is to have personal conversations. Talk with your friends and your family and your loved ones, share factual information. And as always, our COVID-19 information team is always available. Call, text, email, and that information will be put in the chat. But the phone number that I've now memorized is 209-259-1332. And we have a great team there that does their best to answer every question they receive. So just a reminder that we're here to answer questions and have those conversations. And have a great holiday. Merry Christmas.
Thank you all so much for joining us. We really appreciate it. This video will be available on our Facebook page for you to review. We also will be adding it to our website that you can share that link out to individuals who don't have social media. And as always, thank you so much and have a happy holiday.